COVID vaccines heart risk warning update. Background on COVID vaccines and safety monitoring. Importance of vaccine surveillance. Vaccines undergo rigorous testing before approval, but safety monitoring doesn't stop there. Once vaccines are rolled out, health authorities keep a close eye on any side effects that might arise in larger populations. Initial safety data and approvals. When Pfizer, Moderna, and other vaccines first launched, trials showed them to be safe with minimal serious adverse effects. However, real-world data sometimes picks up rare risks that weren't obvious in trials. Recent heart risk warnings. What's new? The latest warning issued recently. Regulatory bodies like the CDC and European Medicines Agency have issued updated warnings about a small but notable risk of myocarditis, heart muscle inflammation, and pericarditis, inflammation of the heart lining, linked to COVID mRNA vaccines. Agencies involved in the update. These updates come after reviews by the CDC, FDA, WHO, and similar agencies in Europe, Asia, and Australia. Their goal is simple: keep the public informed so people can make the best health decisions. What is myocarditis and pericarditis? Definition and symptoms. Myocarditis is inflammation of the heart muscle, while pericarditis affects the lining around your heart. Symptoms can include chest pain or tightness, shortness of breath, palpitations or rapid heartbeat, fatigue or lightheadedness. Why it's linked to vaccine. Scientists believe these rare reactions are an immune response triggered by mRNA vaccines, especially in younger males. However, research continues to fully understand the exact mechanism. Which vaccines are under review? mRNA vaccines, Pfizer, Moderna. Most warnings focus on mRNA vaccines. Pfizer and Moderna have both included updated guidance in their product information leaflets. Other vaccine types, AstraZeneca, Johnson & Johnson, and other non-mRNA vaccines have not shown similar levels of risk for myocarditis, according to current data. Age and gender risk factors. Data on younger male studies show males aged 12-29 are at the highest risk, particularly after their second mRNA dose. However, it remains a very rare outcome. Broader population analysis. For older adults and females, the risk of myocarditis is extremely low, almost negligible compared to younger males. How common are these heart risks? Incidence rates based on studies. Current estimates suggest around 12 to 40 cases per million doses in young males, much lower rates in other groups. Comparison to COVID infection risks. It's important to note that COVID infection itself carries a significantly higher risk of heart complications compared to vaccination. Expert opinions on the updated warning. Cardiologists' perspectives. Most cardiologists agree the benefits of vaccines outweigh these rare risks, especially considering how severe COVID-related heart problems can be. Public health authorities' statements. The CDC and WHO continue to recommend vaccination for all eligible groups but advise awareness of symptoms post-vaccination. Should you be worried? Understanding relative risk. While headlines may sound alarming, the absolute risk remains extremely low. You're more likely to be struck by lightning than to develop severe myocarditis from vaccination. Balancing vaccine benefits versus risks. Vaccines prevent hospitalization, severe disease, and death. For most people, these benefits far surpass the minimal heart risk. Recommendations for vaccine recipients. Symptoms to watch out for. If you experience chest pain, shortness of breath, or palpitations within a week after vaccination, consult your doctor immediately. When to seek medical help. Don't ignore chest symptoms. Early treatment leads to full recovery in most myocarditis cases. Impact on public confidence in vaccination. Addressing hesitancy concerns. Such warnings can fuel vaccine hesitancy. It's crucial to understand that these updates reflect transparency, not increased danger. Importance of transparent communication. Public trust grows when health agencies openly share risks, however small they are.